Chapter 8 Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 1. Listen to dialogue number 1. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple-choice questions at the end of the dialogue.
Hello, are you Rachel Lipton?
Yes, I am.
Good morning. I'm Walter Cronin, the pharmacist. You can call me Walt. How would you prefer to be called, Rachel or Mrs. Lipton?
I've been called Mrs. Lipton for so long. Why stop now? Walt, you can call me Mrs. Lipton.
Okay, Mrs. Lipton. I see that you are here today to get your prescription for sulfasalazine to help treat your rheumatoid arthritis.
Is that what Dr. Solomon ordered?
Yes.
I hope it helps me. My rheumatoid is really getting bad. The pain and swelling has gotten worse, especially on my fingers. My fingers are curling up and becoming deformed. My hips, knees, and feet are stiff. My muscles hurt. I hurt all over. It's so painful, but I try to keep a stiff upper lip.
I'm sorry to hear that it's getting worse. I have reviewed your chart, and I see that you've had arthritis for quite a while, and you've taken other medications. I guess they haven't worked for you.
No, not really. The Aleve didn't help, and the prednisone didn't help, but it made me gain weight. I was even on Vioxx, and it killed some people, and it was taken off the market. So now the doctor wants me to try this new drug. What did you say the name of the drug is?
It's sulfasalazine. It will help to reduce the joint pain, swelling, and stiffness you've been having. Hopefully, it will help to slow down the progression of the disease and prevent further joint damage. Your doctor also wants you to continue with Aleve. Sulfasalazine is an anti-arthritic drug that is used with a non-steroidal anti-inflammatory drug, such as Aleve. Hopefully, you'll start to notice a difference after taking the Aleve with the sulfasalazine.
I hope so. How often do I take it? And what does it look like? Pills come in so many different colors, I get confused sometimes.
I know what you mean. Well, it's a gold color, 500 milligram tablet. It looks like this. It's a delayed release tablet.
What does that mean?
It means the drug doesn't take effect as soon as you take it. You take one tablet with breakfast in the morning and make sure to drink a glass of water too. And make sure that you swallow it whole. Don't chew, crush it, or break it. And take the Aleve too, which, as you know, is yellow.
Yeah, but won't make it easier to swallow.
That may be so, but you don't want to increase the chance of getting an upset stomach if you crush, chew, or break it.
The prednisone made me gain weight. What's this new medicine going to do to me?
Well, first it's intended to help reduce the pain you're having. However, as with all medicines, patients will experience some side effects. You may experience nausea, vomiting, and headaches, along with some other effects that are listed on the drug information sheet I will give you. However, call your doctor if you have ringing in the ear, painful urination, or blood in your urine, or have difficulty breathing.
Is this one of those medicines that won't let you out in the sun?
Yeah, it may make you sensitive to the sun, so avoid being out in the sun too long. And as always, wear sunscreen. Have you had any problems with the Aleve, like stomach bleeding?
No, nothing like that. So if I take this new pill without chewing, crushing, or breaking it, and drink lots of water with it, and take it every day, I won't be feeling all this pain? Sometimes I just want to yell at the top of my lungs. It hurts so bad.
I understand, but you need to know that it may take 1 to 3 months before you feel any improvement.
That long? I'll be tearing my hair out.
I understand, but along with the medications, it's important to exercise. You can ask your doctor to refer you to a physical therapist who can teach you how to exercise your fingers. and exercise is good for the entire body. Of course, it's important to control weight. Too much weight can add stress to the joints on your back, hips, knees, and feet.
If weight is bad for arthritis, then why do doctors give patients like me prednisone, which makes you gain weight?
That's a good question. But you found that prednisone is not good for you. Is there anything that you do to help reduce the pain?
Sometimes, especially at night, I put hot pads around my fingers and on my knees and feet and my muscles. I heat the hot pads in the microwave, and they do feel good on my joints. And of course, Mr. Lipton massages my feet and knees almost every night.
Well, you're very lucky to have Mr. Lipton. You can also try to use a cold pack. It can help to dull the sensation of the pain. Do you have any other questions about the sulfasalazine?
No, you've been very helpful, Walt. Is that it?
Almost. I just need to confirm some information in your chart about your age, allergies, and medical history before I send you home.
Sure.
Chapter 8. Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 2. Listen to dialogue number 2. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple-choice questions at the end of the dialogue.
Good morning, Mr. Brady. How are you today? Do you remember me? I know it's been a while.
Not really. The last time I was here was over 2 months ago.
That's right. I'm Henrietta Washington.
Henrietta, now I remember. How are you?
I'm fine. How are you doing? How are you feeling?
Well, not so good.
I remember that you started to see us after you were diagnosed with COPD and chronic bronchitis. Are you using your Atrovent inhaler?
Yes, but I'm not here for that. I now have arthritis in my spine. The name of the arthritis is hard to pronounce and remember, so I just call it AS.
Is it ankylosing spondylitis?
Yeah, I think that's it. Here's the prescription. I can't really read the doctor's handwriting.
Thank you. Okay. I see Dr. Anderson has prescribed Rheumotrex. He's also indicated that if we don't have Rheumotrex, which is the brand name drug, we can give you methotrexate.
Give me whatever is easier to pronounce, even if it costs more. I have a good drug prescription plan.
Sure, but Mr. Brady, first I'd like to ask you some questions and review your medical and drug history.
Sure, Henrietta, and you can call me Stephen.
Sure, Stephen. First things first. You mentioned earlier that you're using your Atrovent inhaler.
Yes.
How many inhalations do you take a day?
I take 2 to 4 inhalations every day, 2 times a day.
Is it working for you? Has it made breathing easier for you?
Yes, very much.
Have you experienced any side effects that you weren't having before using the inhaler?
No, none really, except in the beginning I did have a sore throat, but then it went away and my throat has just been fine. And now I have AS.
Can you tell me more about that and what took you to see Dr. Anderson?
I was having soreness in my lower back and pain and a tender feeling down my spine, and then it spread to my ribs and my shoulders. I thought it was related to my COPD, so I went to see my lung doctor, Dr. Posner. He gave me some blood tests and an MRI and then told me I had AS. I really got hit between the eyes. He sent me to Dr. Anderson. He's an arthritis doctor.
Well, thank you for sharing that with me. I'm sure both of your doctors will monitor you carefully. They may have explained to you that AS can also cause the rib cage to stiffen and restrict lung capacity and function.
Yeah, I know. Dr. Anderson also told me that I will have difficulty walking and standing, and that I'll be hunched and stooped over when the joints begin to fuse.
Did he mention that you may experience breathing difficulty as a result of the bones in your rib cage fusing together?
So I'll have more breathing problems in addition to my COPD?
Have you noticed increased breathing difficulty?
No, not really. But my doctor says I could have more breathing problems.
Well, it would be a good idea to get physical therapy. It will help relieve pain and give you physical strength and flexibility. And as the disease progresses, you'll develop a stooped posture. But with physical therapy, you can work on standing upright as much as you can. And, of course, not smoking will help. You're not smoking, are you?
No, I gave that up when I was told I had COPD.
Good. Now, let me tell you about your new medication, Rheumotrex. Rheumotrex is a very potent medication. You need to take 1 pill a week. You can take it with food, but you don't have to. But you should drink plenty of fluid when you take the pill, and keep an eye out for any possible side effects such as mouth sores, a persistent cough, and black stools. I'll give you a patient information sheet with detailed side effects. Read it carefully. Also, it's important to avoid alcohol and limit your time in the sun. You may become more sensitive to the sun.
I hope I get relief right away.
Well, it will take up to several months before you feel relief. But of course, if you're having difficulty breathing and moving and you feel you're getting worse, please call both of your doctors. And of course, you can always call me or any of our other pharmacists.
Thank you so much, Henrietta.
Sure, Stephen. Now, before you leave with your Rheumotrex, I just want to double-check some personal and medical history. Are you still at the same address? Do you have any new allergies? Are you taking any other new medications that I don't know about?
I'm still at the same address, no new allergies, and I'm taking Atrovent. And now I'll be taking Rheumotrex too.
Chapter 8. Post-Assessment. Dialogue number 1.
Good morning. Are you Mr. Eric Gallagher?
Yes, I am. Good morning.
I'm the clinic pharmacist, Elizabeth New. How are you feeling this morning?
Well, I have felt better, but it's been hard for me to walk. My right toe has been hurting a lot. It's real inflamed and burning.
Have you had problems with your big toe for a while?
Yeah, I have gout, and I'm having a real big flare-up.
How long have you had gout?
Oh, I guess about 10 years. You know, it comes and goes. I went to the emergency room 3 nights ago. It was really bad. My toe was so swollen and real tender. I couldn't even wear my shoes. I wore my sandals.
Are you currently taking any medication?
No, but the last time I had a real bad flare-up, about a year ago, and my doctor gave me a cortisone shot. And he also gave me a medicine called Probene. I think that's what it's called.
I think you mean probenecid. What did the ER doctor give you?
He gave me a prescription. Here it is.
Okay. I see she has also written a prescription for probenecid and over-the-counter Aleve. Okay, Mr. Gallagher. Since this is your first time in the clinic, I need to ask you a few questions about your medical history, and then I'll go over your prescription with you and tell you a bit more about how to treat your gout.
Sure.
Okay. How old are you?
I'm 53.
Are you currently taking any other medications?
Well, I just finished taking an antibiotic for my Swivers ear. I had a bad ear infection in my right ear.
Do you remember the name of the antibiotic?
I think it was Cort something. Yeah, it was cordyceps, I think.
Did it clear up your ear infection?
Yeah, it really worked fast.
Any other medications?
No, but I take my multivitamins. And I take Metamucil every day just so I don't get constipated.
Have you had any surgery?
Yeah, I had my appendix taken out about 10 years ago. And about 15 years ago, I had surgery on my left knee.
Do you have a family history of gout?
Yeah, my dad. He passed away about 4 years ago.
Do you smoke?
Not anymore. I used to be a 2-pack-a-week smoker, but I quit about 3 years ago after my best buddy died of lung cancer. He was a chain smoker.
Quitting was the wise thing to do. Do you have any allergies?
Yeah, I'm allergic to CAT scan dye.
You're allergic to iodine. Okay, Mr. Gallagher. Now let's talk about how to treat your gout. The doctor has prescribed probenecid. Probenecid is used to help lower the high levels of uric acid in your body. When your body produces too much uric acid, crystals form in the joints and cause gout. Hopefully, the medication will reduce the chance and severity of a future gout attack. The doctor also wants you to take Aleve, which will help to reduce the inflammation. Have you taken Aleve before?
Yeah.
Any problems with it?
No. Should I watch for any problems?
Well, in some patients it can cause stomach bleeding and ulcers, so just keep an eye out.
How often do I take the gout medicine?
Take the probenecid twice daily, and make sure you take it with food to reduce stomach upset. It's important to also drink a glass of water with the tablets, and drink at least 8-ounce glasses of water a day to prevent kidney stones.
I hope this gets rid of my gout.
Well, I need to warn you, it's possible that you may experience more gout attacks in the next month while the medication helps the body remove the extra uric acid in your body, so don't stop taking probenecid if you get another gout attack.
But isn't the probenecid going to take the pain away?
No, it's not a pain reliever. That's why you need to take Aleve for pain relief. Also, keep in mind that in some patients, probenecid can cause dizziness, loss of appetite, sore gums, and frequent urination. I'll give you a complete list of the side effects. Please read them very carefully.
These gout attacks are really difficult to stomach.
I know, but it's important to know that there are also other ways to help relieve symptoms. First, avoid or limit alcohol. Alcohol prevents the excretion of uric acid. Second, always maintain a healthy weight and drink plenty of fluids.
No beer with my buddies?
Try not to have more than 2 drinks a day, but right now I would advise against drinking. Do you have any other questions, Mr. Gallagher?
No, you have really educated me.
Okay, now I just need to ask some personal information, questions, and then I'll get the prescription for you.
Chapter 8. Post-Assessment. Dialogue number 2.
Good afternoon, Mrs. Vo. How are you today?
Okay, and you? Please, you can call me Vicky.
Sure, Vicky. I'm Anthony Gonzalez, and I'm fine today. I'm the clinic pharmacist, and I'm here to see how you're doing and to review your prescriptions with you. And you are here today because you have a prescription for osteoporosis.
Yeah, osteoporosis. I have weak bones, and my doctor said I have brittle bones.
I also see from your chart that you have had 2 cataracts removed, one on each eye.
And now I can see better and more clearly.
When did you have the cataracts removed?
I remember very well. It was October 6, 2005.
Did the doctor give you a medication for any reason?
Yes, Dr. Wu, W-U, not Dr. Wu, W-O-O, he gave me Lotemax, L-O-T-E-M-A-X.
Thank you for spelling both the name of the medication and the doctor's name. You make my job easier.
Sure, no problem.
Can you tell me why Dr. Wu gave you Lotemax?
He told me to help with eye inflammation.
Did it help?
Yes, very much. I can see good again.
Mrs. Vo, I mean Vicky, are you taking any other medication?
No, I am healthy, but now Dr. Jones told me I have osteoporosis. Not easy to pronounce.
I know what you mean. Were you feeling pain in your body before you went to see Dr. Jones?
Yeah. Sometimes I have a little pain in my back, and I don't walk with my back straight.
Yes, people with osteoporosis will experience back pain, and very strong pain if they have a fracture. A fracture is a break in the bone. And people with osteoporosis will begin walking with a stooped posture, which means the back is no longer as straight as it used to be. Some people will get shorter.
Yeah, I'm starting to walk like an old lady.
How old are you, Mrs. Vo?
68. But I feel strong. But now I have osteoporosis.
Did Dr. Jones give you a prescription?
Yeah, she told me it's Fosamax.
Okay, that's Fosamax. Did Dr. Jones explain how to take this medicine?
She said take 1 pill a day and I will feel better. If any problems, I'm to call her.
Okay, I will give you some important information.
Good.
It is very important that you take the pill every day. Are you taking any other medications?
No.
Okay. Now, it's important to take the tablet with a full glass of water and that you swallow the tablet whole. Don't chew it or suck it. Do you understand me?
Yeah, just take quickly with water.
Yes. Then make sure you do not lie down. Your body must be upright. Sit on a chair, stand, or walk, but do so for 30 minutes. After 30 minutes, then you can eat your meal and have your tea or juice. Do not drink water.
I must be very careful. This is serious medicine. This helps my osteoporosis?
Yes. Fosamax will help to stop osteoporosis and help you from losing bone. Stopping osteoporosis, or bone loss, will help you to keep your bones healthy and help your bones from breaking or from getting fractures.
Good. I will take my medicine every day, as you say.
Also, pay attention to some problems you may have. Some medicines have side effects. For example, some people who take Fosamax have stomach pain. I will give you the patient information leaflet that explains all the side effects. Read it carefully.
I will read it with my son. And I have Vietnamese and English dictionary. I will read carefully.
That's a very good idea. Vicky, do you have any allergies?
Yes, bees.
Now, it's important to remember that you cannot eat certain foods with this medicine. For example, you should not eat foods such as citrus fruit, like oranges. Don't eat tomatoes or tomato sauce. And try not to drink coffee, chocolate, soda, peppermint, or pepper.
No problem. I don't eat those foods.
Okay. Do you have any questions?
No, not now. You are very helpful. I can call you if I have question?
Sure, you can call me. Here's my card with my name and phone number on it. And of course, you can also call Dr. Jones.
Okay. I have an appointment with her in 1 month for a checkup.
AVN Pharma Education.